Dear Chairman, thank you for the invitation to present at EBC 2021 meeting. The title of my presentation is No Side Branch Strut Opening After One Stent Simple Crossover Strategy. In the current expert consensus, including EBC, provisional strategy is standard approach for bifurcation PCI. However, after simple crossover stenting, there are various options for the treatment of side branch ostium. According to the previous FFR study, it is well known that the anatomy and functional discrepancy exist in jailed side branch in non-left main bifurcation. Previous randomized or large registry study demonstrated that the routine side branch opening after simple crossover stenting did not make better clinical outcome up to 5 years, and the incidence of side branch related TLR rate was not different. We know that the benefit of PCI is related to the burden of a target myocardium. And the previous CT study about myocardial mass analysis showed the burden of a side branch myocardium is usually lesser than 10%. However, if side branch myocardial burden is large enough like circumflex, this change may affect clinical outcome. Therefore, we performed several studies about this issue. First, we confirmed that the anatomy and functional discrepancy still exist in jailed circumflex, but still there were concerns about the efficacy and safety of this FFR approach for left main bifurcation. Especially, previous pathologic studies showed the risk of thrombosis in the protein strut of side branch ostial. So our group did a 5-year clinical follow-up after FFR measurement in jailed circumflex. If FFR was low in jailed circumflex, their clinical outcome was very poor. And in those patients, should be treated with additional complex procedure. However, if FFR was negative, more than 8.0, their outcome was acceptable up to 5 years. In terms of a protein strut issue, these angioscopic images from Japanese doctor gave us very important insight. Most of these protein strut are not much thermogenic and were covered with healthy neointima in current biocompatible or biodegradable polymer DES. Furthermore, serial OCT study demonstrated that the minimal lumen area of jailed side branch ostium was well maintained up to 2 years. The most of a protein strut was covered after 1 year. In terms of clinical outcome, 2 large registry data from Korea and Italy showed the strut opening after simple crossover stenting also did not make a better clinical outcome. However, during this provisional strategy, we have to remember the lot of POT, proximal optimization. COBISII registry data reported that POT make a better outcome during the provisional strategy. And the benefit of POT was observed in the enlarged minimal stent area in proximal part of main vessel, like in this IVUS study. And FFR of side branch did not improve after POT technique. Therefore, the positive clinical outcome of POT was originated from the main vessel benefit, not side branch related. So, ladies and gentlemen, this is my summary slide. Previously, we routinely treated side branch strut after simple crossover stenting with complex procedures. However, according to our experience, when we do the provisional approach, simple crossover stenting with POT, then if it seems to be need additional procedure, just to do FFR. And if FFR is positive, do the additional complex procedure. However, if FFR is negative, medical therapy can be acceptable. Thank you very much for your kind attention.